Hello, everyone. Welcome. Welcome to Lead with Compassion. This is our virtual monthly webinar series. My name is Val Lance Geffro, and I'm the Director of Communication Education in the Sanford Institute's Center for Compassionate Communication. Happy spring. We're almost there. Today, we're thrilled to welcome two people who work in palliative care. Social worker Chris Onderdonk and our own Dr. Gary Buckholtz. And of course, our brilliant admin, Norma Nava, is here to keep things running smoothly. Chris and Gary's talk today is on moral distress and how that plays out in healthcare settings. And they also have a tool to share to help you begin to articulate for yourself the areas in your life or work that might be triggering and steps that you can take to address them. I've been privileged to hear this presentation live, so we are very, very excited to bring this to a larger audience virtually. So you're in for a treat. Chris, I'm going to throw it to you now, and I hope you all enjoy.
Thank you, Val. I'm Chris Onderdonk, and I am currently working in inpatient palliative care at UC San Diego Hillcrest. And then I did hospice care before that, but am more recently in palliative care. Gary?
And I'm Gary Buckles. Really happy to be with all of you today. As Val said, I work for the Center for Compassionate Communication as affiliate faculty director. And Chris and I developed this tool to working together. So we're very excited to share it with you and also look forward to your feedback if you choose to use it or use it with groups of people as we suggest. Please give us feedback on how it's going.
Okay. So here's what we're going to be doing today. We're really looking at this, trying to give folks a framework, because sometimes, at least when I started looking into moral distress, there's just so much out there, and it can be so overwhelming. And a lot of the literature is focused on more on the individual level or the practice level. And so the work that Gary and I have been doing is really trying to move this more into a leadership and education space. So we'll be exploring, trying to name that moral distress on that level. And again, we're hoping that there'll be more clarity. By the end of this talk, you'll kind of be what I call moral distress detectors, both in yourself and perhaps in others. We have a 5-step debriefing tool, and then we're going to be running through that tool actually with a real world case, which we always find is more beneficial as it becomes real. Okay, so obviously we need to start. Actually, I'm going to back up. One of the things that we are hoping for is for a little bit of interaction. And so right now, the best way for you all to do that is going to be in the chat. And so Gary's going to be monitoring the chat and bringing some of those responses into the talk. And as you're sort of listening, we're going to invite you to be reflecting on your own experiences once you kind of have a sense of moral distress in your own either professional or whatever role you might be in. All right. Anything else, Gary, that I missed there?
Hope you got it.
Okay. All right. So if we're going to talk about moral distress, obviously we need to define it, right? What is it? And the most kind of basic way that we think about this is in any setting, when you know what is right, at least something you feel is right, but somehow that action is being blocked. And there's some way where you're feeling your hands are tied. And again, we see that play out often, at least in palliative care at the bedside. But more and more, especially in today's climate, we're seeing that moral distress rising to those systems level. It did originate with Andrew Damaton, and so shout out to if there's any nurses out there. This is kind of where the concept of moral distress was born. Um, and really, we're talking about distress in the sense that this is a really unpleasant and troubling experience. These are the ones when you're walking to your car and you're just feeling heavy, and then you get home and you're still thinking about it. So these are the kinds of situations that we want to focus on. And so this is the invitation. Try to think of, as we go through this and thinking about my hands are tied, try to think of a personal example where this might have occurred in your life, and really try to hold that as we're going through these various details, because it kind of makes it more real. And we're going to be inviting you not necessarily to share the situation itself. What we're going to be asking folks to do is share your experience on many levels, on the physical level, the emotional level, on sort of your behavior. And so those are the things we're going to be inviting you to add to the chat as we go through here. Starting with, again, these sort of signs and symptoms. If you're going to be a moral distress detector, you have to actually know what you're detecting. And I want to see these and frame these. Sure, we can call them signs and symptoms, but I prefer to call them signals. These are signals that are being sent to you as a human, and sort of we want to pay attention to those signals. And so, starting with the physical, now we live in a culture where our entire kind of civilization is kind of born in the mind body disconnect of going back to Descartes. I think, therefore I am. As a result, I think one of the biggest challenges we face, especially when we're experiencing moral distress, is noticing what we're feeling in our bodies. And I'm, from what I could tell, we're starting to become a little more comfortable, I guess, with this conversation and just noticing. And so what I want to invite you all to do is, if in the chat, if you're thinking about that situation that you were in, what kinds of things are you feeling? And we're going to suggest here maybe some fatigue, exhaustion. For me, when I'm feeling distress, I get this feeling in my throat right around this region. And that's kind of when I know that something is rising up in me. For a lot of people, it's in their stomach. So maybe let's hear from some folks, if you can add to the chat where you feel it in your body when you know a morally distressing, or your hands are tired and you're in a situation like that. Give you a second.
Yeah. So, Chris, I'm seeing insomnia. I get the throat thing too. That's from Val. Head and neck, pounding
Yeah.
heart.
Oh, the heart.
Again,
Yes. Increased heart rate. Yeah. And the shoulders. Yeah. What else?
yeah, head and neck pains, throat issues, feeling queasy, exhausted, all of the above.
Yeah.
Nausea, shoulder tension, body temperature increase,
Yeah.
insomnia again. Yeah.
Yeah, so I think the main point we're making here is that often moral distress shows up very quickly in our bodies. And so again, if we can start seeing these things as signals, as things to start giving us something to pay attention to, that's that awareness that we're trying to cultivate. Oftentimes we find these bodily sensations kind of start then evolving, and they can sort of lead and rise up into some pretty strong, intense emotional experiences. And I know those of us that wake up in the morning before we come into our various jobs and our roles, we certainly are not, this isn't what we're looking forward to necessarily, but then next thing you know, there you are, your hands are tied. And again, we're going to have a more specific case to make sense of this, but obviously, feelings like just feeling frustrated, feeling powerless, um, feeling sad. Anxiety is definitely one that we hear about. It sort of becomes almost all consuming in a way, like you're uh, thinking about it and feeling on edge. what are some feelings that people feel? Maybe, again, this is an opportunity to sort of put in the chat when you're feeling your hands are tied.
Yeah, Chris, while we're waiting for folks to drop something in, I
Yeah.
know what I've learned about myself is when I'm faced with something like this, I have these tendencies to want to go crawl under a rock and just kind of withdraw. And it's not something I'm like proud of, but to know when I'm having those feelings, it really helps me to think, oh, I need a different approach. I can't just go crawl under a rock.
That's
Um,
interesting because as you were talking, I was realizing I do the opposite. I tend to get loud and become intense, and then people are like, "Dude, what is wrong with this guy?" Like, and often I've become more and more aware of that over time. So it's interesting that we have, and I think that really
yeah.
highlights that people have different ways of responding emotionally. Are you seeing anything in the chats there?
Yeah.
Or?
So Anna Downey says I do the opposite too. Exhausting feeling. What's the point? Irritability. I want to eat. Difficulty
Oh, me too.
concentrating. Feeling
I
of
also want to
dread.
eat. I eat my feelings. So, was I not?
Frustration. Rumination. Short tempered. Totally agree with loud, intense. Demonstration for my past passion. I guess again the opposite of me.
And again, this speaks to being aware of ourselves, and again, seeing these as signals like, I'm and here's me, I'm getting loud. What is going on? And just sort of having that curiosity. All right. And so looking at the behavioral part of this, and this is really where it starts to play out in community. And perhaps it goes from being sort of more of an internal kind of distress then to like it affects what we do. And when anything affects what we do, it's going to impact the people around us. And so again, we can see here there's the avoidance piece. There's the perhaps, avoid, not coming to work. And I'm feeling sick today. And if you're noticing not wanting to go in, or if there's a specific person that you see as the root of that moral distress, perhaps avoiding that person, or perhaps things coming across in an unprofessional way. Um, these are the sort of behavioral, and they do have consequences. And so that's why we're hoping this talk, if we are increasing your awareness, the hope is before you start acting in these ways, you can perhaps kind of head it off at the pass, if you will. And I think that's kind of what we're hoping in raising awareness about moral distress and these issues. Anything to add there, Gary?
No, I
Okay.
think you covered it.
Okay. Okay. So moving on, thank you, by the way, for everyone and your input. These webinars can sometimes be challenging because we're so used to being in each other's space, but hopefully this is a way that we can continue to kind of be together. So we really appreciate your engagement with that. So if we're going to sort of be moral distress detectors, we do need to be able to sort of discern between moral distress and these other things that show up in the literature. And like I said before, moral distress, you know the right thing to do, but somehow you're being blocked, your hands are tied. This is different than an ethical dilemma, because in an ethical dilemma, there are actually actions that will be taken or can be taken. They just have a different perspective of like doing harm, potentially doing harm, but hey, there could be benefit. An action will be taken. It's not necessarily blocked. It's just something that has to be sorted through. So that's the difference between an ethical dilemma and moral distress. We talk about, I'm going to move down to empathic distress, and then we'll get to burnout in a second. I think this is an important, this is the most common misconceived, like when people are feeling moral distress, what they might be characterizing it as is empathic distress. That is feeling things very deeply in relationship to another human. And so at least in the work we do in palliative care, there is a term, compassion fatigue, that is often used. And I'm one of my crusades is that we can stop perhaps using that term, because what we know now in the science is that compassion doesn't fatigue. And instead, what they're really describing is feeling with another human. And it's that sort of really on a level of exchanging. You're seeing someone hurt and then you're feeling that hurt. Again, different than moral distress, because moral distress is often happening on a more systemic level, not on necessarily that interpersonal level. And of course, all of this, what we're talking about, can lead to burnout. And that's just that chronic feeling of exhaustion when all of those things around you, or perhaps you're feeling, are not changeable. And so you experience that burnout. And so if moral distress is not sort of nipped in the bud, or you're not aware of that, definitely burnout is a consequence. And the same goes for moral injury, which we're going to show. Moral injury is really the result of repeated episodes of moral distress and then having them not be resolved. And so we have a visual, I think, that'll hopefully help. And I don't know, in the literature, they talk about, I think it's better to just come here and look at this visual. You'll see in the literature a lot of talk about moral residue. And so if you look here, this is a very easily way to sort of identify it. So we're having moral distress. We have that event. Okay, the situation ends. Maybe it didn't go as well. And we kind of still have that lingering feeling. Oh, well, here comes another episode of moral distress. And yes, the situation ends and there's that residue. These repeated events, and again, this is from the Alberta Health Services document on moral distress. Those repeated events of distress and residue can lead to moral injury. And that is basically, it feels more like a trauma at that point. Your body experiences it as something traumatic because it truly is threatening your deepest sense of who you are, that you continue to participate in something you feel is wrong. So again, what we are trying by having this talk and introducing the tool, we really are trying to prevent, if we can, sort of things escalating and cascading into this, what's called the crescendo effect of moral distress. Anything to add there, Gary? Anything I missed or to add?
No, I think I do think, to connect this to behaviors, I think when I've noticed others getting there, or even myself, I think when we spoke about that slide on behaviors, I think those can broadly sort of be classified as professionalism issues, right? And that's, we're not at our best selves when we're having professionalism issues. And so my hope, through use of this tool and thinking through this for our audience, that if you're seeing others with professionalism issues, this, if you put your detector hat on, there could be some of these underlying issues to maybe help explore a bit.
I'm glad you brought that up, because, and I like the idea of not only a detector in yourself, but in others, in our coworkers, because then we can give people some grace. And so I am trying really hard in my personal life, in my professional life, to stay in curiosity when we sort of see these behaviors, and stay in I wonder what's going on with so and so. And when we have this awareness, we can wonder, hey, the way they're describing things, I wonder if this is moral distress. And it's amazing when I have named that for other people, the feeling of relief people feel like, yes, that's it. I'm not a jerk. I'm just experiencing moral distress. And I think that's a really important point. And we hope that'll be one of the outcomes of this talk as well. Maybe a little grace for our coworkers. Okay, so this is where um, when Gary and I were sort of talking about this, I've given a lot of talks on moral distress, more on the micro level, because that's kind of what I encounter pretty much every day in my role in inpatient palliative care. Um, Treatment that's considered non-beneficial, people hooked up to machines. What are we doing is a very common refrain of moral distress. Like, what are we doing? Um, Obviously, patients and families struggling in that. And then, of course, safety issues. And we see practice that just is unsafe, and somehow I'm participating in that. What we were sort of, especially when we were thinking about this, is how this really translates this concept more to what we might think of as macro. And just as a point, social workers, we are systems thinkers. We're always thinking about people within the context of their environment. So we're always looking at what we call the micro, the meso, and the macro level. So just so you know, a lot of this is just because that's the way social workers think. But what are we seeing? We're seeing much more on this macro level, especially in this in this environment when we're seeing resource constraints, people losing their funding, whole projects being canceled, and how this not only affects them, but is really affecting the people around them. And I think you'll see that reflected in the case that we bring. And I think this is one of the other big take homes that I hope you'll take with you is that oftentimes, whatever the individual distress is, we can pretty much trace it to a larger systemic issue that's going on. And this really helps kind of depersonalize this experience. And it can be, in a way, empowering to say, well, gosh, this might be actually bigger than me, and that's why this is so difficult. Gary, anything to add there?
No, I think we can go on to the
Cool.
to this tool.
All right. Yeah. So this is kind of the point that we were sort of making in that sense of where are you in this picture? And the reason we chose this picture is just to kind of capture that systemic complexity. And the reason we made this tool is, we're not going to solve that, what you see in front of you, but maybe with this tool, I could maybe break things down into some digestible chunks, because this here, what's in front of you, will not be broken down in digestible chunks. So that's kind of what our big ambition is for this tool, to take what you see in front of you and really distill it down to something that you can process and digest. So this is how we put it together. We wanted to name our references, or name the various tools that we used. The 4A's is a very common, or that's the one you'll see a lot in the literature, especially in the nursing literature. We ask, we affirm, we assess, we act. And then, as we've noticed, we've mentioned already, the Alberta Health Services, we found their document on moral distress to be absolutely so valuable. They have sort of more of a 10-step program or a process, and Gary and I just kind of wanted to distill that down. A close colleague of mine pointed me towards Dudinsky's map. They sort of also have what they call like a roadmap to navigating distress. And then what will end up sort of being what I see as one of the more powerful parts of discerning moral distress, of what we call the circles of discernment, and where we discern what we can control, what we can influence, and where our areas of concerns are. And this will make more sense once we start moving through the case. Okay. So before we get into the case, here are the 5 steps, and that we came up with based upon all those models. And what you'll see at top is like, well, yeah, I'm really glad that made it in there. Notice and name your distress, Chris, because you keep talking about how important it is to be aware and to be able to detect those signals. So that is the first step, is noticing and naming, identifying what is the actual conflict, what is getting if your hands are tied, something's getting in the way. What are those barriers? And what do I control? What do I influence? And where do I kind of need to draw a line and have some boundaries around that? And then creating a path forward, which we think is important. And I think now is a good time to mention that as you're imagining this tool, go back to that situation that I had you think about earlier. Maybe another situation now has come up. I think an important point we want to make is you might be working with this tool alone, but ultimately, we think it's essential that the conversation about that moral distress moves into a collective with someone else, not alone, because moral distress feeds on isolation. Moral distress loves isolation. So please, as we're going through this tool, as much as it is sort of an individual experience, it really is needs to be a collective process eventually. So let's move into the case, shall we? Go ahead, Gary. Help us out.
Great. So this is Dr. Someone you may know.
Which
And
I do want to just add. I thought I read it wrong, and I thought that was actually the doctor's name. So just
yes.
FYI, in case you're wondering, like, I know that guy. No, you don't.
So this is an infectious disease clinician researcher who sees HIV patients. His research is focused on screening for rectal cancer in this important patient population. And of course, like many of us, just wants to take excellent care of his patients, prevent morbidity, mortality, especially in this vulnerable patient population that he's really gotten to know and love over time. Um, Cares deeply about this community and wants to have really long-lasting healthy impacts on this community. So, unfortunately, with the NIH changes and funding cuts, his grant funding was canceled, um, and he was told by his department that he's basically going to need to do more clinical time to make up for the lost funding. So he's trying to balance this health equity commitments against institutional priorities and larger political pressures. So we want to jump in here and actually before we jump into the steps with his case, I just want to mention some actual patient commentary about him, an amazing human being who truly cares and makes me feel heard and respected. I always feel safe and well informed and made as comfortable as possible with him. He saved my life many times over our long association. So this is the kind of person that we're talking about that's going through this really unfortunate change.
So and as we go through each step, Gary is going to share this gentleman's actual experience moving through these steps. So we're really fortunate to have kind of a real world example of this. But again, as we're going through this, you can start in your own case to apply it as well. So as we've already talked about, so important if you're going to be a moral distress detector to just notice and name exactly what it is you're facing. We need to know what is the situation, what is the actual context of what's happening, right? That's the way we make sense of anything. And then that's where we tap into our body and we tap into our minds and sort of what am I experiencing? What am I noticing am I feeling more anxiety than anything? And then really just naming like what are the consequences of this and why is this so important? What's making this so important to me and understanding that?
Yeah, and for our friend, we kind of covered the situation and the consequences, but in terms of his emotion and what he needed to notice, and processing this with him using this tool, he said, I don't mind seeing more patients. I really I very much enjoy patient care, and I'll be okay in this, but I feel very heavy and numb getting through the day, worrying about my patients who are going to face really grim consequences with this loss. I mean, we're talking about preventing cancer in this patient population. He said he felt powerless, that his research was not valued, and that his patients ultimately were not valued. And ultimately, he felt discrimination.
And I think I just wanted to add, because I'm not sure not sure we made this point, but talk about, as you're saying that, Gary, like the feelings of responsibility and the feeling of maybe even guilt. So even though if you go back to that big picture of all those systems, taking on the burden of that and feeling like, wow, I'm really letting people down. And this just isn't me. So as you were sharing that, that kind of occurred to me. And so that might be another signal, the feeling of almost like a loss of self-worth coming up, guilt, shame even. Okay. It seems kind of obvious, but in this case, getting more down to brass tacks is better than not. And so what are the actual actions? Like, okay, if your hands are tied, what essentially were you reaching for? What were you trying to do? What are the actual actions that you're trying to take? It's really important to know that. And sort of speaking to kind of what I was getting at there, what values are being compromised? And again, when we talk about values, I just want to pause there because values are what make, I mean, that's what we grow up learning from our parents. That's what we learn in the way that we live our lives. So when we say compromise values, these are some of the most closely held parts of who we are, both as humans and as professionals.
Yeah. So back to our friend. Obviously his prevented action was the inability to do these screenings and then also finish his research, which had implications obviously for himself, but the larger research team he was working with. And then in terms of the compromised values or the values in conflict, for him, the value of community was really big. The value of doing research and progressing science and helping this patient population. And then conflict could be the fiscal responsibility of the healthcare system, right? The healthcare system may also feel like their hands are tied, right? We can't, it takes money to do the work that we do. Also preventing for, his values, preventing suffering in this patient population, and maybe the conflicting values of, you know, no DEI work, decreasing the cost of the NIH. Maybe you could argue tax cuts or balancing the budget in some way is a competing value at a government level.
Hmm. So once we have that, once you're sort of kind of starting, and again, it starts to become a little more embodied once we really start to sort of notice what we're feeling and we actually are starting to write down and name those things. And then, of course, we need to be pretty clear, as clear as possible, any particular barriers and tensions. And, um, you know, we could say like, hey, you got to check yourself, right? We hear that a lot. Hey, you got to check yourself. And this is a moment to check yourself. Is it possible that some of these barriers are something about you? There may be something about you that has to shift. Or maybe, hey, this is it, man. This is who I am, and that's the way it's going to be. But those are sort of those more internal kind of barriers. And some of them, that, there might not be much room for compromise. And then, like, again, thinking like a social worker, what are some of the organizational barriers that might be going on? You're going to have them within your institutions where you work. There's very specific policies and very specific behaviors to your actual institution or whatever setting that you're in. So what are those? And then other external barriers. And kind of this is what we all have been experiencing as of late, especially with the NIH funding and sort of these larger socio-political sorts of barriers that are unfolding now in our day-to-day lives. And I think this is such an important part of the tool because at some point you're going to have to choose where am I going to focus and where's my energy going to go. So it's really important that we have these barriers really mapped out because it is going to inform kind of what's next.
Yeah, and again, back to our friend. So, in terms of exploring these barriers and tensions, internally, for him, it was really just a lack of inertia. The problem felt far too big for him to tackle, and then along with that, he felt a fear of retaliation. Um, that he'd seen played out in other places. And then in terms of external organizational barriers, I mentioned university dependence on state and national funding. That is a reality. Um, other external barriers, there's the national political hostility, the and just the NIH cuts that are happening.
Hmm. So then we've done all that now. Okay, we have that laid out in front of us. Now, people at this stage might be tempted to just start diving in and start acting right away and maybe start writing an email or, next thing you know, you're on the phone calling someone. This next step, we encourage a pause button at this point and to sort of move to this next step because this is what's going to ultimately inform action. And so this is something we call the circles of discernment, whereby we are very clearly writing down and identifying things I can actually control, things I might be able to influence, and then things that are actually totally outside my control. Now, I think this, I'll just speak to my own experience. Once this model was introduced to me, it has helped on so many levels. I'll just say it's helped on my clinical work in the hospital. I've been sort of going through a checklist. But now that we're in this climate and in this environment, and there's so many challenges going on, I'm finding this to be even more powerful. Because if I'm able to identify what can I control? Okay, well, I can control the tone of my email that I send. I can control who am I going to email? I can control sort of my relationships. These are things I have absolute control over. And, some people, if you're a leader, you might actually have control to make a difference or to change a policy. So that's something to ponder. What we find more commonly are things I can influence. And this is really where community becomes such a vital part of this process, that you're not doing this alone. Who can I reach out to? Who can I partner with? Who can I collaborate with? There must be something I haven't thought of. Um, if you don't have control, and here's where a lot of people, and it's a really fine line between the next one, the things that are out of my control and the things I can influence. Some folks, and I'll just name it for myself, it's easier for me to say, well, oh, well, it's out of my control. There's nothing I can do about it. I might very well be missing an opportunity for something I might be able to influence. And so that's why we really encourage you all to take an extra beat before we get to this next level, which are the things that are ultimately outside your control. And I will just speak to this because I think for many people, this is probably the hardest part of this whole model. And this really rests on boundaries because the things that we can't control can sometimes cause the most distress to us, oftentimes because we're under the impression that we can control it. And so there really is a moment there where once you realize something is out of your control, it's a very powerful moment to set that boundary and say, I am concerned about that. I have to focus my energy elsewhere. And so this, especially now, this is a really hard one. And I think boundaries are not something, boundaries are sort of in fluid and they're flux. They're not something you can actually see. It's something we create. So very powerful here.
Yeah. So, Chris, for our doctor friend, in terms of what he felt like he could control, um, of course, managing his emotional and professional response to this. He felt like he could seek out alternative funding and support, working with our foundation, trying to find some philanthropy, communicating ethically with his team and his patients. Um, he could contact lawmakers and reach out. He could write an op-ed. We've got another webinar on how to do that. Um, he could make career decisions ultimately and do self-care. And in terms of what he could influence, his at the department level, he could influence leadership at our institution and the colleagues at that level. He could participate in institutional advocacy, of which there was significant advocacy and is significant advocacy happening. And he could provide mentorings. He could influence how he mentored his trainees, and that was actually an area he did decide to focus on. Was that's what I can control, is how the team that I also care about, their experience of this, and as a leader, how I might be able to influence that. And then things he's concerned about, but of course can't really control, is the national funding policies and the political climate at this point in time, institutional high level decisions and priorities. So the C-suite, he at his level, he really didn't have much influence at the C-suite level of our institution. And then broader systemic inequities. While there might be some long-term advocacy potential there, not something that he really had control over in the short run.
And I just want to name, as you were talking, I just how hard it is to say, to just acknowledge when something is out of our control, especially as a social worker. We're all about social justice, and it is so difficult to like, what are those boundaries? You just want to feel like I can change the world, I can do it. And so again, I just want to name to just what a tough part of this the process this is. All right, so the hope is once you've kind of mapped all that out and you've kind of gone through the tool, just be practical. What are some, what's the first step? And I'll tell you, sometimes we identify some real low-hanging fruit where we're like, you know what, that's easy. That's something we can do. Maybe that's a good place to start. Again, I really see, I hope all of this takes place more not alone, but in a collective. Reach out, collaborate with somebody, make a partnership. This is, hey, you know what? We need to work together on this. This is something that we all care about. Those connections. I mean, that's kind of how, we see change really happening, not like sitting alone. I didn't change anything by sitting alone in my office. That rarely changes anything. It's really the relationships that we develop, and the partnerships and the collaborations that, and really making sure that we're affecting things as much as possible on a organizational level.
So back to our friend and creating a path forward, trying to figure that out. Some immediate steps that he took. He met with the leadership that he could meet with. He sought out allies in that with other colleagues as well, and he did explore new funding through foundation and philanthropy. And he, this was something that was also important. He documented the impact, so that he could do future advocacy work, the impact of the losses that were happening, and making sure to take note of those very carefully. Um, and he reassessed his career path. And is this, of course, I mentioned he was fine seeing more patients, but is that really, you know, as a leader, where his skills were best suited? He'll never give up patient care completely, but this is someone with significant leadership potential. Um, and ultimately, along those lines, he did make a career change, and found himself in a significant leadership role where he could have even more impact and create more ripple effects. But in that process, he sought out support. He engaged in self care, and sought out peer support, and engaged with some of the resources that we have at UCSD that Chris is going to mention.
And I do want to, oftentimes, after working through this tool, and I'll just share, I didn't use this tool specifically, but there was a point in my career where it was accept it, change it, or leave. And once you've worked through those steps, it's a hard, man, that is a hard thing to realize. Like, wow, if I can't accept it and if I can't change it, well, I guess I'm in that spot where I have to leave. That's a tough place to be. And yet, as I hear this story, I'm like, wow, so he ended up in actually a more impactful and powerful position. Interesting, very interesting indeed. Definitely food for thought there. Oh yes, Norma. So this is the part where you get to share the tool. So here it is, folks. Long awaited. You've been waiting this whole time. Let's see the tool. Well, here it is. Navigating moral distress. And you'll see all those steps laid out there. We encourage you to share this widely. You're free to use it, however, will be helpful. We've been using it around here in different situations. And I do want to name again, this is the reason we made it this way on the organizational leadership level. When I do teach moral distress, like on the nursing level, I pretty much focus on those circles of discernment, because things have to be moving pretty quick. And if you have really the time to really unpack these things, whatever that email you're sending, whatever that communication you're having, it'll be so much clearer if you use this tool. And you'll have perhaps even sorted through, like, no, I'm not going to say that actually. And it's just the message will be so much more powerful, we find, after sorting through this.
Yeah, Chris, if I can just add, we're
Yeah.
finding this tool really very effective in small groups as well. And that creates that support that Chris is talking about, that avoiding that isolation. And when we do this in groups, of 10 to 20 people, what we find is, as people spend a little bit of time individually on this tool, then there tend to be themes that arise. And if you have a group of 20, then people can get into smaller groups of similar themes and talk this out, and really that those circles of discernment really become more apparent through a little bit of group work. And also those immediate steps. What are some really actionable items? Doing that as a small group can be really helpful.
Okay. And so, yeah, so this is where we encourage you after this webinar, if we've asked you to call to mind, or maybe some situations you have faced or perhaps are facing currently, and use the tool and see how it goes. Give it a shot. And then, as Gary said, this is not like this is the way it is tool. This is an evolving document. This is something that's living and breathing. We are always learning. It's never done. So whatever feedback you may have on this tool, or hey, you guys, why didn't you think of this? Or hey, you might have missed that. Boy, we would love to hear that because again, we're not going to sort of get through moral distress on our own. Is there anything else that we need to talk about there, Gary?
No, I think you covered it. I think the
Okay.
resources slide would be in terms
Yeah.
of, yeah.
So some of this is going to be more specific to the UCSD environment for those of you who are in that environment, but peer support and mentoring, well, that is pretty much anywhere and everywhere you can find it. I will, I'm going to put a plug in because I'm getting older now. I've been doing a lot of mentoring. And so for those of you both seeking out mentorship, but those of you who perhaps are in a position of mentorship, like I volunteer at one organization to do some mentorship, very rewarding for those who haven't stepped into that role. And I'm sure many mentors would agree. But reach out. I reach out to my mentors all the time. Like, help me out here. Here at UCSD, we have a program called the HEAR program. And I will tell you, when I was about a little while ago experiencing my own moral distress, I used the HEAR program. Extremely helpful to me. I didn't have the tool at that time, but they definitely helped me unpack a lot of what's going on. And then, even though we might not have an ethical dilemma, we do find that the ethics team and the ethics committee can be so incredibly impactful. Again, just to help us, especially when things are super complex and they're just hard for one human to kind of get their head around. That's what the ethics committee is there for, to help us unpack some of these extremely challenging ethical ideas. And again, strongly recommend that you all use these. Anything else, Gary, that you want to add?
No, so the HEAR committee is, or the HEAR program, I should say, is specific to UCSD, but seek out those resources likely exist on some level at your institution. So learn about what's there and seek it out.
Okay, so just to wrap up, um, obviously, we're moving this to the leadership level because we really do believe that, at least I'll just name my own experience. When I was an individual and kind of struggling with my own moral distress, it really helped that my leadership, that I could go to them and they understood kind of this larger scheme of things. So if, in terms of leadership and education, there's a real opportunity here to show a commitment. And now you have a tool that can help you make sense of it. And so it's the both and. I've been sort of preaching the both and, we need both that sort of individual and that team and that's the way things evolve. And then again, I hope the takeaway is, and hopefully now, maybe you're not a professional moral distress detector, but maybe you're closer to being a moral distress detector, both for yourself and for the people you care about, your colleagues, your team members. And all you got to do is wonder, I wonder if this is moral distress, and then take a moment and pause before we start jumping into things. And hopefully, this will help you respond in a more impactful and meaningful way. So, thank you, everyone. And now are we gonna pause maybe, or we're gonna maybe take some comments and questions
Yeah,
if we have a little
did,
time. Let me look at the time. Okay, we
we
have
have some time for
about 5 minutes.
questions,
Yeah.
but currently I don't see any questions posted or comments. Here's one in the chat here. I have two questions, maybe related to your question about feedback on the tool. I think it's important not just to identify value conflicts, but also strengths/values to lean on to determine the path forward.
Oh,
Also in step 3, what about facilitators at all 3 levels? Strengths,
ooh.
relationships, resources, structures, etc. Lastly, I love the idea of getting to the group/system level, maybe a step 6 that happens in a group setting. I like that idea.
Step 6. Beautiful. And I love this comment because it embodies the spirit of our work here, in that it's ever evolving and we're never going to do it alone. And so I love that, and I love the creativity there. It's kind of very inspiring.
Yeah, I like the comment about strengths and values as well. We started this presentation with, right, a lot of this is values based, right? When we're feeling
Yeah.
more of the stress, so helping to identify those values a little bit more and tease out strengths within that as well. I
And
like that.
and as a social worker, it's like Chris, because social work is all about the strengths perspective when we meet folks. So Chris, you better focus on your strengths there, buddy. You're the social worker. So I really appreciate the the comment there. Yeah.
Okay, I'm not seeing any other questions or comments in the chat or in the Q&A.
Okay. Well, then we'll take a minute here to put up our next virtual workshops. We have some QR codes there that you can learn more. I don't know, Val, you want to speak to these?
Yeah, sure. Thank you guys. I mean, what a great presentation. And I really love Kimmy's idea too about adding strengths values into this tool. That was really inspiring. And I really enjoyed the presentation again. So thank you so much for this work. We're excited next month, April 15th, from 8 a.m. to 9 a.m. Pacific time. That's 11 to noon Eastern time. You have to do the math if you're in the middle of the country. When leaders listen, how clinician insight shapes departmental and system-wide action. And this is presented by Lisa Williams from the University of Kentucky. She has some great advice and resources to share with us. And then we also would, if you're interested in a deeper dive with our team, we have our Lead with Compassion workshop coming up 2 mornings in April and another 2 mornings in May. And we hope you'll consider that and help us spread the word on all of these programs. We're thrilled that you came. We will post this video to our website later this week, definitely. We'll see how quickly that is able to happen. And we'll also post the tool so that if you want to share this with your colleagues or friends, that both will be available to you. Thank
Val,
you
there's
so
a
much for
question
coming. Yes,
question about Lead with Compassion.
yes.
Is Lead with Compassion one of those 4 sessions or all part of a series?
It's all part of a series. It's a very condensed version of our fellowship that we run here at UC San Diego. So it's about 12 hours of instruction. And if you go to that QR code, you'll be able to see what each day offers, and it kind of parses it out for you. So, and if you want to chat further, feel free to shoot us an email, and I'm happy to give you more information. So that's it. That's our webinar for today, and we hope you enjoyed it. Share with your friends. We love to expand the audience and bring these ideas and tools to more and more people around the world. So thank you for joining us.